Carcinoid tumors are another malignant tumors involving the lung. Carcinoid tumors accounts for about 5% of all pulmonary neoplasms. They are considered as malignant tumors and best described as low-grade neuroendocrine carcinomas. Carcinoids are composed of cells that contain dense core neurosecretory granules in their cytoplasm and rarely may secrete hormonally active polypeptides. Most carcinoids originate in main bronchi. Peripheral carcinoids are less common. These tumors are considered well demarcated, and carcinoids grow in one of two patterns. The first as an obstructing polypoid spherical intraluminal mass. The second is as mucosal plaque penetrating the bronchial wall to fan out into the peribronchial tissue. This is called the collar pattern lesion. The figure at the top shows an obstructing polypoid tumor within the lumen of a bronchus as an example of the first growth pattern. The figure below shows a collar pattern appearance. As you can appreciate, this type of patterns has two surfaces. One is wider than the other. This resembles the second growth pattern, where the mucosal plaque are seen at the mucosal side and penetrates through the bronchial wall to fan out into the peribronchial tissue. This figure shows carcinoid tumor growing as a spherical mass protruding into the. Histologically, typical carcinoids are composed of nests of uniform cells. These cells have regular round nucleus, salt and pepper chromatin, absent or rare mitotic figures with little if any pleomorphism. A typical carcinoid, on the other hand, show a higher mitotic activity with a small foci of necrosis. These tumors have higher incidence of lymph node and distant metastases if compared with a typical carcinoid. About 20 to 40% of cases of the atypical carcinoid tumor have p53 mutations. So now you can imagine that typical carcinoid, atypical carcinoid, the large cell neuroendocrine carcinoma, and the small cell carcinoma can be viewed as a continuum of increasing histologic aggressiveness and malignant potential within the same spectrum of pulmonary neuroendocrine neoplasms. This figure shows the histologic findings in typical carcinoid. As you can appreciate, the tumor is composed of multiple nests, مثل عش العصفور. Each clinically, most carcinoid tumor presents with signs and symptoms related to their intraluminal growth. The growth of these tumors within the bronchus may result in cough, hemoptysis, recurrent bronchial and pulmonary infections. As a result, we expect that peripheral tumors to be mostly asymptomatic and to be discovered incidentally on chest radiographs. However, in rare cases, pulmonary carcinoids induce carcinoid syndrome, which is characterized by intermittent attacks of diarrhea, flushing, and cyanosis. The reported 5 and 10-year survival rates for typical carcinoids are above 85%, while their rate dropped down to 56% and 35% respectively for atypical carcinoids.